Thank you, Roy. Thank you. Thank you for that extravagantly generous introduction. Roy talks about my interest in worms as if it was something unusual. I can't imagine anybody not being interested in worms. They are fabulous, they are beautiful, they are just wonderful. And someday I'd like to tell you about them. But I'm especially glad to be here for a number of reasons. For one thing, I used to teach a course on the history of medicine at Drew University, and so I'm very aware of the towering figure of Galien, and so it's an extra treat to be at an organization that bears his name. And as Roy mentioned, right out of grad school, I came to Merck. I thought I'd give it a try for a year or two, and I stayed for 33 years. And in a paper that should be out in the next day or two, in fact, I refer to that period as a cauldron of intellectual excitement and stimulation when I worked at Merck. And I said I learned faster and I learned more than in grad school. The focus, of course, was different. It was now more focused. But it was a wonderful, wonderful experience, and just full of excitement and full of collaboration. Because as I've said many times, in industry, collaboration is not one of the options as it is in many other places. It's a way of life. You just can't go about your business without collaboration. And so, for example, the fact that I don't really know any chemistry was okay because there were so many fantastic chemists right at my side. So it was a wonderful experience. Now, in the last few weeks, not surprisingly, people have asked me how it felt when I heard that I had won this big prize. And the answer is very easy, but not necessarily easy to say. But there were two emotions, simultaneously, instant emotions. One was joy and gratitude, as you would expect, but the other was sadness. Sadness at the realization, which is always with me, that all the people who were involved in this development being so successful, this drug ivermectin being so successful, cannot all be named individually. And that will linger. It's common to give acknowledgments to the sort of people in the back room and so on, but this is different. I mean, this is just a huge effort by a team of teams. And I consider that I am a representative of that team. And the only way that can ameliorate this feeling of sadness is if I can make it understood that I am a representative of the Merck research team. Some of you may know something about the drug ivermectin, and I suspect a lot of you don't know much at all. So I thought I'd say a couple of things. One about the role of ivermectin in the sphere of animal health, and the other in the sphere of human health. And in relation to animal health, the thing that comes to mind is that, as Roy mentioned, in animal health, you face huge varieties, huge numbers of different species of parasites. In sheep and cattle, for example, there are about a dozen worms just in the intestine, very important roundworms. And generally speaking, if your drug fails to hit one of those effectively, that is a flaw, probably a fatal flaw, depending which one, but it's usually a very serious flaw. You have to try and get them all. But not so in the case of dog heartworm disease. And that was a special interest of mine because before the discovery of ivermectin and the related avermectins, I set up a program to look for agents to control heartworm disease. Then I went down to Georgia to learn how to produce billions and billions of mosquitoes, for example, because you need those, they are the intermediate host. And so I set up that whole life cycle going. And then ivermectin came along, and we were able to show that it had an unusual effect on heartworm. Now, with heartworm, the main pathogen is the adult worm living in the pulmonary artery and the adjacent heart chambers, but actually primarily in the pulmonary artery, causing arteritis. And if you're worming dogs routinely, you want to kill the worms, except for the adult heartworm. You do not want to kill the adult heartworm, because killing the adult heartworm in a dog is likely to result not only in the death of the worm, but the death of the dog and serious damage to the veterinarian's reputation. So you don't want to kill heartworm incidentally. There are occasions, certainly, when you do want to kill the adult heartworm, but you don't want to do it incidentally to general deworming. It's a specialized case. Well, it happens, and I can't say that thanks to any human brilliance, it happens that ivermectin is not active against the adult heartworm. I mean, it's just made to order, so you can give it safely and not worry about having to not killing the adult worm. So that's an example of what would normally be a liability turning out to be an unexpected asset. And in the case of heartworm also, it's very active. The dog is very active against the circulating microfilariae in the bloodstream. And that's a separate issue. But that means that if you kill the microfilariae that are circulating in the peripheral blood of the dog, then mosquitoes aren't getting it when they bite that dog. So there's a whole thing of suppressing transmission. But in fact, the most important thing of all, with respect to ivermectin, was that we found that while it did not kill the adult worm, which is good, it does kill the worms before they reach adulthood in the heart. So before they start causing this damage to the pulmonary artery, they are migrating through the tissues. And when they come in, and they're 1 or 2 days, that's okay, but it's much better if you could get them right up to the point where they enter the heart. So it happens then that this drug was just ideal to allow the first development of a once-a-month pill for dogs instead of a once-a-day. The previous drug had to be given once a day because it only hit the very, very young ones. And a lot of, excuse me, I feel a sort of echo. Are you hearing me all right? Okay, good. One of the things, no, I've forgotten what I was going to say because of that. So it kills, oh yes, the immature worms, before they get to the heart, it will kill those. And a lot of people thought, when it was introduced as a once-a-month pill, that may be a little scary because it suggested to a lot of people that the drug was circulating in the tissues and the blood of the dog for a month. Well, it's not, it doesn't work that way at all. It's actually in and out very quickly. It's mostly gone in a day. But if you treat the dog today and kill the immature worms, then if you treat a month later, it will kill all the worms that have come in during the past month. So it works as a once-a-month pill. And that turned out to be a very, very profitable drug for the company. And one thing I'd also mention just in passing, I need to watch the time, I guess, is that after penicillin in the late 20s and then this development in the 30s and so on, microbiologists used screening of microbial fermentations against bacteria, for example, to discover new antibiotics effective against bacteria. So we've had, since penicillin, many other successful antibiotics. But how many antiparasitic, how many anti-worm drugs have we had doing it that way? None. Zero. Zilch. And I think that's because there was a mysterious methodological impasse, partly because people sort of felt, it couldn't be done, and yet that was the key to the success of ivermectin. So that's something to say about its use in animal health. In human health, it has, of course, gained a lot of attention because of its activity in river blindness. It's also active in a related worm disease that causes lymphatic filariasis, which in some patients leads to elephantiasis. But for river blindness, it has become the drug of choice and has been very successful. And in river blindness, you have a different relationship between disease and life cycle stage. It's similar in the sense that with river blindness, the adult worm is not much affected by ivermectin. It is affected, but it's not sort of killed outright by the worm. But it happens that in the case of river blindness, the serious pathogenicity is not caused by the adult worm. It's caused by larvae migrating in the skin and through the skin all over the body, and some of them through no fault of their own, because it's not the worm's fault, really. Some of them reach the eye, and that, of course, is disastrous. So it leads to river blindness. And this is a tragedy on several levels. Obviously, it's a tragedy on the individual level, but it's also a tragedy at the village level, because often in Africa, you'd have villages where 50% of the adult population would be blind, and the village simply couldn't sustain itself. And so the villagers would abandon that village and retreat away from the rivers, because it is associated with rivers, because it's transmitted by a black fly that breeds in the rivers, actually in fast-flowing river water. And so, losing my train of thought again. So the microfilariae, the immature baby worms, are the ones that are causing the damage, and they are killed by ivermectin. There was a previous drug that would kill them, but the trouble was it would also make blindness worse, because there would be a hypersensitivity to reaction caused by that drug. But with ivermectin, it doesn't. It kills them more slowly, and perhaps that's the reason. But anyway, it kills them without eliciting this response, so you can give it very safely for the prevention of river blindness, but not for the cure. If somebody's eyes are completely destroyed, this does not restore them, but it does prevent it. So if children are treated once a year or twice a year with a little tiny pill or a couple of little pills, if they do that regularly, they will not develop the skin disease or the blindness associated with this disease, river blindness. So that turns out to be very effective, although initially greeted with some skepticism in some quarters. But it actually turns out to be good and to be safe. And of course, the thing that really made the difference and put it on the map was the fact that it was made available to people who would not normally have access to it. And you obviously know about that, and indeed you have already celebrated that in a way. But one little thing that I just mentioned about it, that we used to say, and when teaching about this, that the disease, river blindness, was not caused by these microfilariae living in the eye, but microfilariae, these baby worms, dying in the eye. But we don't say that anymore, because about 25 to 30 years ago, it was discovered that these worms that infect people are themselves infected with a bacterium of the Wolbachia kind, and there's lots of evidence that in fact it's reaction to the dying bacteria that causes it. So you see, it's not really the worm's fault. They wouldn't do anything like that. So that was a new wrinkle on this whole business of the pathogenesis. But to get back to the fact that it is available to people who need it, this was the result of a decision made by you-know-who, Roy Vagelos, and I know that you have celebrated him before, and because of that decision, river blindness is eliminated from the list of public health diseases in many countries, It's under control in many countries, and it is now certified to be eliminated in quite a few countries. And the program in Africa, it was more feasible to eliminate it in Central and South America than in Africa, because the vector is not so good. It's Simulium ocratium instead of Simulium damnosum. The black fly is a different species, so it was a bit easier. But in the continent of Africa, it was considered that the elimination was just not feasible. But now, officially, by those who are doing these things, the program has shifted its emphasis not to control of river blindness, but to elimination of it, and they have set a target year for doing it. And so this, for me, is very neat because it gives me a very nice ending to my talk, because Roy Vagelos introduced me, and I can now turn back things over to Roy Vagelos.